Hello. I want to give everybody working and conducting business in Carmel an update about the city's response and actions taken in regard to COVID-19 or the coronavirus. But as I think about everything that's transpired in our country and our city over the last few days, of Nelson Mandela's famous quotation, where he said that courage is not the absence of fear, but the triumph over it. We can get through this by working together, listening to medical and health professionals, and using some common sense. I'm going to try and give frequent updates as this crisis unfolds and continues, so that everybody knows what the city is doing to try to keep you safe and try to contain the virus. This is serious. I think many people for a long time did not take it seriously, but I've had the opportunity to be on telephone calls with the top health experts in the United States, from the CDC, from the Center for Disease Control, and this is a serious situation. They encourage us to do simple things, to stay at home unless there's a reason we can't stay at home, to wash your hands frequently. If that's not possible, to use hand sanitizer, but washing hands is better, they tell us, to stay at least 6 feet away from anyone we're talking to, but generally avoid all unnecessary contact with other people, particularly people who are at risk, who have compromised immune systems, or elderly, or have underlying health conditions that could make their immune response to this virus less than robust. City Hall remains open, although most of our employees who are able to are working remotely. Carmel was very far along in being able to do things electronically and online, and we're encouraging people to do that. There's very few people at City Hall. Most of our business, which is still occurring, is being done by our employees who are working at home. We have made the decision not to have any utility disconnects for non-payment during this period. We recognize that there's a great many people who don't have large savings accounts, who don't have resources or family to draw on, and may not be able to pay their bills for a period of time. So our water and sewer department are conducting no disconnects. I wanted to tell everyone also that our website has a dedicated page for COVID-19. Now, if you go to the site, www.carmel.in.gov, go to that site, you can get updates 24/7 to see any news and what the city is doing in response to this challenge. I have issued an emergency disaster declaration, which is allowed under state law. We're not going quite as far as some of our neighboring communities, but there are some things we need to do to help stop the spread of this virus. A watch is not the highest level, but it is a watch. Travel advisory is in effect starting 7 p.m. on Wednesday, March 18th in the city of Carmel. The disaster emergency declaration I put into effect today advises against all but essential travel within the city boundaries of Carmel. Let me explain what the exceptions to non-essential travel. And that's travel related to medical care or diagnostic testing for yourself or someone you're transporting. Travel required to provide care to another for whom the traveler is a primary caregiver is accepted. 3, travel for mandatory employment activities. We're encouraging all our employers to allow their employees to work at home, but we understand that certain people have to be at physical locations, and so that is an exception as well. We are accepting travel required to obtain fuel, food, groceries, medication, and essential household goods and personal hygiene products. We are accepting travel related to food delivery and to the resupply of retail stores, pharmacy, and food pantries. We are accepting travel for recreational purposes where the driver and passengers do not leave the vehicle. We understand that everyone's cooped up and they may just want to go for a drive. That's okay, but don't get out of the car unless you have to. And we're accepting travel by individuals engaged in employment needed to restore utility services or provide other emergency medical service. The emergency order also closes all public playgrounds in the city of Carmel. This is being done because where children generally don't get COVID-19, they're able to transmit it. They're able to infect others, and they go home to their families, and they may spread it between children and so on. And the most recent research this morning from medical experts across the country indicates that this virus may be able to live on solid surfaces for up to 3 days. We do not have the staff or the ability to constantly be cleaning playground equipment. The virus may remain on plastic, it may remain on metal and other surfaces. So we're going to close our playgrounds. Our parks are going to remain open for walking and biking. We are ordering that all gyms and workout facilities within the city of Carmel are closed except for individual one trainer, one guest sessions. All banks, credit unions, and investment services located within the city of Carmel are ordered to allow only drive-up, ATM, or one financial advisor, one client services. Inside teller stations need to be closed. We're requiring that all hospital and ambulatory surgical centers and other doctor's offices located within the city of Carmel postpone all elective services and appointments and non-emergency surgical procedures in accordance with and subject to Governor Holcomb's executive order. We're requiring that all retail businesses located within the city of Carmel whose facilities have drive-up capability require customers to use that drive-up capability only and close the main portion of their store. And then all bars, restaurants, nightclubs, and other establishments that provide in-dining services within the city of Carmel must close their operations to in-person patrons and provide drive-through, takeout, and delivery services only in accordance with and subject to Governor Holcomb's executive order. We're very hesitant to take these drastic measures in the city of Carmel, but we believe that they are necessary for the public health of the people living in this city and as part of the national effort to limit the spread of the virus. The theory, according to medical experts, is that if we're overwhelmed the way Italy was or the way China was, we don't have the hospital beds, we don't have the protective equipment, we don't have the trained respiratory therapists, ventilator operators to handle a large onslaught of patients. I'm aware of hospitals in California that have actually had to put up tents in their parking lots to handle the onslaught of patients. We have to slow this virus down, and the steps we take today will be very helpful, we think, in 5 to 20 days out from now, if we can slow the virus so that our excellent healthcare system can respond appropriately. We just can't be overwhelmed. We have had to deal with things like this in the history of the United States before. We had the 1918 flu pandemic that swept across the world, killing tens of millions of people at the conclusion of World War I. We had wave after wave of polio epidemics in this country as well as around the world through the 1920s, 30s, and 40s, and early 50s until the polio vaccine was finally available for distribution and inoculation of people in 1954. I was talking to my mother, who turns 90 this year, and she was talking about how movie theaters and restaurants had to close in the 1930s and 40s as a girl as these polio epidemics came through. So my point is that we have dealt with viral epidemics before. Tuberculosis, it was another problem that we had to deal with until proper medicines were discovered. The difference this time is that we know modern medicine can come up with a vaccine within 12 to 18 months. But the next few months are going to be critical in making sure as few people are impacted by this new virus as possible. Carmel needs to do its part. I'm confident that the citizens and people in this city will step up and do the right thing. Along those lines, there's two things that you can do that are very important. Number one, we still have emergency surgeries and accidents where people need blood. Our blood donation centers are open, are extremely safe, they're constantly being cleaned, but we need people to go out and give blood. We have a shortage of blood today in the city of Carmel and across the United States. The second thing is there are food pantries that help people who are going day to day, and many of these people are restaurant employees and others who have now lost their jobs, that we continue to donate to those food pantries. The city of Carmel just yesterday delivered checks out of our discretionary funding to those pantries to help them restock. One of them was totally out of food, and they're being very cautious at the food pantries. Patrons have to drive up to the pantry. Volunteers will take their order, go fill it inside, and bring the groceries to their car so that they're not inside spreading the virus if somebody happens to have it. But those two things, donate blood, donate money or food to our food pantries. You can find the contact information for our food pantries on the city's website under COVID-19. I know that the citizens and businesses of Carmel will step up and do everything they can to successfully deal with this new challenge. Thank you.